I squeezed into my 2 small zebra leggings for you guys today, so let's do this. Today is International Day of Visibility for Disabilities, so I thought I would talk to you guys a little bit about my diagnosis journeys and what I've been going through. So I have Ehlers-Danlos Syndrome. I was diagnosed in 2018. I have type 3 or hypermobile type. Also, the most common type, in case you didn't know. I'm meeting more and more people, especially on TikTok, who have this or have EDS of some sort. There are 13 different types, if you didn't know, because my doctors don't. Where do we even start? I've had health problems on and off my whole life. My whole family kind of does, which is why for the longest time we didn't suspect there was anything, quote, wrong with me. I have had diagnoses of scoliosis, plantar fasciitis, which I got diagnosed with once I started having trouble in gym class in middle school. I couldn't keep up with the other kids. I was complaining that my legs and back and feet hurt all the time. I got a lot of, oh, it's growing pains. Are growing pains even a real thing? Because at this point I'm convinced that it's just gaslighting for kids with disabilities. 2016, I was accepted to nursing school, and I started to have a real problem during clinicals. I thought that I was just out of shape, that I would develop more muscle tone and stamina over time, but I was getting up at 6 in the morning to drive a half an hour to the hospital where I was doing my clinicals. I was working all day until 3:30. I would get home and just collapse. I couldn't stay awake to do my homework or anything because I was just so sore and tired. And I thought that it was an attention problem, which it very well might have been because, fun fact, ADHD and autism are comorbidities of EDS. If you don't know what a comorbidity is, it means these diseases often go hand in hand. They seem to be related. Experts don't really know why, but they often are found together in people. So I failed out of nursing school and started seeking an ADHD diagnosis. While I was in therapy, my doctor started to realize that I was having a lot of physical symptoms, not just attention issues. So I started to try to see specialist doctors to figure out what was going on with me. I have chronic joint pain, and I just thought that everybody hurt. It took me a long time to realize that what I was experiencing was pain because it was just my normal. Also, my family's normal. My mom has chronic pain, my dad has chronic pain. Several of my siblings have chronic pain. If one sibling is diagnosed with EDS, there's a 1 in 4 chance that another sibling has EDS. So me, my siblings, at least one of them also has it. Sorry. Well, I started seeking treatment from a rheumatologist because from what I've learned in nursing school and from what you hear, rheumatologists are supposed to be like the joint guys, right? And it was a bone and joint problem. They treat arthritis. This feels like arthritis. I should go see them. And I got a diagnosis of fibromyalgia, a very real condition. I'm not dumping on fibromyalgia or anybody with fibromyalgia. It just didn't feel right. At the time, I was like, oh, thank God, a name for it. This is what I've been feeling, and I have friends with fibromyalgia who reached out in community, and I love them and I appreciate them for it. But the more I looked into it, the more I realized that it wasn't right. And while I was experiencing pain in those areas, it doesn't feel like nerve pain. Nerve pain is like described as a tingling, burning, stinging sensation, and I get it every once in a while, but it's more from a pinched nerve due to a bone or joint subluxation. What is a subluxation? Well, let's get into what Ehlers-Danlos Syndrome actually is. Ehlers-Danlos Syndrome is a genetic connective tissue disorder. Connective tissue is kind of like the glue that holds all of our bodies together. It's found in every system of the body: soft tissues, bone, blood is a connective tissue. So collagen, you'll notice on my shirt, and notice collagen and collage share a root word. So collage, meaning glue, and collagen is the glue that holds our bodies together. Collagen is a protein, and in people with EDS, we carry a gene with a mutation that affects our body's blueprint for collagen. So we produce collagen that is extra stretchy, extra fragile, sometimes has holes in it. It's not as strong as you want the substance that's holding your whole body together to be. So what does this mean, symptoms-wise? We're kind of falling apart on all levels. Sorry. This means that our musculoskeletal systems are kind of weaker and more fragile than an able-bodied person. So for me, my bones and joints are not stabilized by healthy collagen. In an able-bodied person, collagen provides that extra stability for your muscles, ligaments, skin, blood vessels, the whole shebang. Hypermobility, which you may hear referred to as double jointedness. Most people with Ehlers-Danlos Syndrome have some level of hypermobility, but especially people with type 3, hypermobile type. My joints slip out of place. It takes minimal pressure, if any, to push, say, my shoulder out of joint. When it's a partial dislocation, it's called a subluxation. I experience subluxations way more than I experience full dislocations. My first dislocation was what they call nursemaid's elbow. I was about 2 years old. My mom describes me throwing a temper tantrum, not wanting to leave the park, her pulling me along by the hand, and my elbow just out of place. Not her fault at all, because now we know they just do that. So because of all this instability in my bones, joints, tendons, ligaments, skin, I experience a lot of pain. It's constantly rattling around in there, and I can feel that I'm not supported. I've developed osteoarthritis, which is really common. That's another comorbidity. I have it in my knees, and I suspect in other places, but the knees are the only place that the doctors have checked so far. Right now, sitting here talking to you, I have a lot of pain in my mid-back because I'm leaned forward in my chair. I need special chairs with special support to keep me out of pain. Standing for a long time is not an option. 1, because of the pain it causes me, and 2, because of another comorbidity I'm going to get into called dysautonomia. Dysautonomia is an umbrella term. You may hear a lot of people with EDS say that they also have POTS. POTS is a form of dysautonomia. I do not have a POTS diagnosis. I have a postural hypotension diagnosis, which is like POTS's cousin. It's also a form of dysautonomia. It falls under that umbrella term. My understanding of why dysautonomia often comes along with Ehlers-Danlos Syndrome is that faulty collagen weakens my blood vessels and their ability to contract and pump blood throughout my body where it needs to go. There's also a disconnect similar to fibromyalgia between my brain and my nervous system, where my autonomic nervous system, those functions like breathing, digestion, that you're not supposed to think about, that are just supposed to happen, I have to think about them or they might not happen. I was diagnosed with asthma as a teenager, and I now believe that that was actually a symptom of the dysautonomia. My body just doesn't regulate my breathing, and sometimes it feels like I can't get enough air. Perfectly happy saying that I have asthma and using a rescue inhaler, but I think it's related to the dysautonomia as well. So the main thing for me with dysautonomia is syncope or near syncope episodes, which is fainting or almost fainting. When I'm on my feet, because the blood vessels lack the strength to pump blood to all areas of my body. Gravity pulls it down into my legs and feet. My blood vessels can't pump it back up into my brain to keep me awake, keep me functioning. So if I'm on my feet for too long, about 12 minutes according to my tilt table test, I will lose consciousness. I'll pass out. I use some aids to help me get around town. We recently went on a trip to DC and I brought my rollator, which is a walker with wheels. I have lovingly nicknamed her Janice. Don't know why. Hey guys, editing Jessie here. It's because Janis Joplin was the first CD that I ever owned. It's a walker with wheels and a seat, which is great because when we're walking around, I have that extra stability. If you've ever gone to the grocery store and just kind of loved leaning on your grocery cart while you're walking around, same. Helps give me that extra support in my skeleton while I'm walking around, and then if I need to take a break, I have a chair. So I just sit down right there wherever I need to, catch my breath, wait for things to kind of regulate, and then I can move on. Sometimes when we're on vacation, if we've traveled by plane or something, like I can't always bring my rollator with me. It doesn't always fit in whatever travel vehicle we're using. So I have in the past rented wheelchairs or mobility scooters to get around. On my honeymoon to Disney World, I rented a mobility scooter from Scootaround. It was so great. Last time I had gone to an amusement park, my feet hurt so badly by the end of the day that I got into the car and I just yelled, and my dad and younger brother were there. Sorry, guys. It just takes a toll. It's like I can feel my body breaking down throughout the day. But when I had my scooter, I felt so free. I could get around and, get to ride in a matter of minutes instead of having to stop and take breaks every 100 feet or so. I feel bad for my husband because he walked the whole time. There were some times when he was like, oh, my feet are really sore. Can I sit on your scooter for a little bit? And I let him. Disney World, by the way, is really great about accessibility. All of the cast members were so nice, and they really helped tie in me using a mobility aid with our magical experience. Particularly when we were in Toy Story Land, I had to park my scooter and transfer to get on a ride, and they said, just park your Hot Wheels right over here. And I thought that was so funny. We also went to Galaxy's Edge, and they said, land speeders go over here. So they do a great job not making you feel different and like you don't belong. My cat's stuck in the closet. Molly, I'm trying to make an educational video. Can you get out of my sewing supplies? She's fine. So on the topic of mobility aids, I want to talk about internalized ableism. One thing that my family has always said, unfortunately, is that using a mobility scooter or a wheelchair makes you complacent. And my mom in particular has always believed that being overweight is harmful to your health. Let's say that. I had a great grandmother who used a mobility scooter toward the end of her life, and she also happened to be overweight. And my mom always told us that she was overweight because of the scooter, and that the scooter made her gain more weight, implying that weight gain and laziness were her cause of death. So regardless of how my mom may or may not have meant the thing she said about my grandma, the message that I was getting and the belief that I came to hold was that wheelchairs and mobility aids were only for lazy people. Studies have shown that they actually help you conserve energy so that you have more energy to work out later, like if that's a thing that you're concerned about. I know for me, I have a ton more energy when I use like the scooters at Walmart to get my groceries. Then I still have energy to actually unpack them when I get home. Versus if I just did it walking around in a cart, like I would probably pass out halfway through my trip. But to me, using a mobility scooter and a wheelchair have become conflated with gaining weight. So, because of the ideas of using a mobility aid that I was brought up with, I have a voice inside my head, a toxic shame voice, that tells me that I'm not deserving of using my mobility aids. All this to say that using a mobility aid like a wheelchair or a scooter is completely valid, and I need to work through my own internalized ableism over this so that the voice inside my head stops telling me that I'm lazy for using the tools that I need. And as you can see, I'm a thick bitch. I need tempo. This has also contributed to a lot of my doctors dismissing my concerns. When I first started talking about having chronic pain with the various doctors I was seeing at the time, they were often dismissive. They told me, oh, just lose some weight and the pain in your knees will go away. They hurt because you're lugging around all that extra stomach. Like, wow, rude. I promise you, I've been hurting since I was in high school and very skinny. Had an eating disorder, and I still was in pain. I just happened to be fat when I started asking around. The problem wasn't going away, the problem being the chronic pain. I actually fired an endocrinologist. I no longer see an endocrinologist who was treating me for my thyroid because every time I went in, he went over proper portion sizes. There were posters all over his walls about diet culture and caloric intake, and he was just like, make sure that you're always getting this many vegetables on your plate, like always a handful and only this much meat. Like, okay, dude. At the time I was eating only Blue Apron, getting plenty of vegetables. I was limiting my soda intake, and I was still gaining weight because of the medications I was on, and maybe because of genetic predisposition. Like, I don't know, it just happened. And I realized recently that I don't care. I like how I look. Okay? Okay. But every time I go into a doctor's office, I get an unsolicited comment about my weight. When I ask about physical therapy, because a lot of people with EDS find strength training helpful, everybody's like, oh yeah, that'll be great. Oh, that'll be so great for you. Oh my God, I'm so happy that you're doing yoga. You're gonna look so good. Like, I don't want to look good. I want to feel better. This is turning into a rant. Anyway, my diagnoses are considered invisible disabilities because if I'm not using my mobility aid, you would look at me and think that I was perfectly healthy. Maybe not perfectly healthy, but if I'm having a good day and you encounter me in the grocery store just walking around doing my business, I might not look sick to you. So Ehlers-Danlos Syndrome, Dysautonomia, IBS are all considered invisible illnesses. And that's the theme of today's Day of Visibility for Disabilities, is that not all illnesses are visible. I'm often afraid to go out in public with my joint braces or my mobility aids because I get a lot of questions. People come up to me who I don't know and ask, oh, did you just have surgery done? And I have to politely explain, oh, no, I was born this way and it's just gotten worse. And they look at me so confused or so concerned, and it's not their fault. It's the way society has brought us up to expect able-bodiedness from people. And sometimes it's from people who have had procedures done and have had to wear that joint brace or have had to use a walker while recovering. So they have the best intentions, and I want to be patient, I want to be kind, I want to educate. But it gets really annoying. I don't owe anybody an explanation for why I'm using Janice to get around Walmart. I just don't. Where I will always try to be sensitive and understanding is with children, because they don't know that it's, rude to ask those questions, especially if they phrase it away like, what's wrong with you? I would use that as an opportunity to educate. My husband says I always go off on the medical spiel of like, Ehlers-Danlos Syndrome is a genetic connective tissue disorder affecting collagen production. It's a mouthful. Like, what's the shorter way to say it? I don't know. Help me out. Another fear I have when I'm out in public is that people will see me get up to reach something on a high shelf or walk a few steps and think that I'm faking. And my toxic shame voice also tells me that I'm faking, even though I know that my symptoms are very real. My diagnoses are hypermobile Ehlers-Danlos Syndrome, Dysautonomia, postural hypotension, irritable bowel syndrome, osteoarthritis, scoliosis, hypothyroidism, depression, anxiety, and PTSD. And I'm probably forgetting at least 5. Yep, I forgot asthma,
temporomandibular joint dysfunction, polycystic ovaries, chronic fatigue, that's a big one,
and my auditory processing disorder, although that one hasn't been diagnosed yet. Let's get into zebras and why we call ourselves that. I actually have a story. When I first started asking my doctor about connective tissue disorders and potentially EDS in particular, she actually said to me, well, I don't think it's that because it's just so rare. She said to me, doctors have a saying when it comes to diagnosing. When you hear hooves, think horse, not zebra. She actually said those words to me. That phrase has become so infamous among the rare disabilities community that we actually call ourselves zebras now. Because, yes, when you hear hooves, it's more likely that it's going to be a horse than a zebra. But that doesn't mean that zebras don't exist. When it comes to diagnosing, the most obvious answer is usually it. But in my case, I felt that Ehlers-Danlos Syndrome was the obvious answer. And luckily, I found a geneticist who felt the same way. I had to pay for a one-time visit out of pocket, but in 2018, under a clinical visit, I was diagnosed. And I'm still not being properly treated by anyone because rheumatologists, turns out, don't treat Ehlers-Danlos Syndrome because it doesn't affect the immune system, at least not in my particular case. I don't have a positive rheumatoid factor, so my arthritis, because it's not rheumatic, they don't want to treat me. So I was like, okay, let me go see like a bone guy. Orthopedist. And they haven't done anything for me either. Most of them are surgeons, at least in my area. You don't want to do surgery on a person with Ehlers-Danlos Syndrome because we have a delayed healing factor because of our messed up skin. So closing surgical incisions can be really tricky and take a long time to heal. So the joint guys couldn't do anything for me, and the bone guys couldn't do anything for me. They kept recommending me to physical therapy, and I would go, but I get exercise exhaustion really easily because of the dysautonomia. It's really hard to do a full workout. So finding exercises that I can actually do and be consistent with once I get home just hasn't proven possible yet. I'm currently in between facilities, in between doctors. I've never been put on any pain medication stronger than ibuprofen, and I really need to be. A lot of people with Ehlers-Danlos Syndrome have been found to have symptoms comparable to late-stage cancer patients. Like, the chronic pain is as painful as cancer. And right now I'm just kind of living with it. A lot of people find medical marijuana really helpful. Unfortunately, it's not legal in my state. CBD oil is, so I'm giving that a try. I've called several clinics out of state. I'm trying to find just somebody who's literate in Ehlers-Danlos Syndrome because my last rheumatologist asked me what collagen was. By this point in the video, you guys probably have an understanding of why that's very concerning when my whole syndrome revolves around collagen and what it is and what it does. I can't really hold down a job because of my symptoms. I was lucky enough to be hired as a temperature checker. I screened for COVID-19 at the entrance of a business. I was lucky enough to be connected to that business through my mother-in-law because she works in HR there. I stayed for about a month because sitting in one place in the chairs that they had there was just so uncomfortable that I could not think by the end of the day. All I could think about was how much pain I was in. And I was going to PT at the time and doing my exercises, 2 or 3 doctor visits a week, and it was not helping. And I was just desperately trying to be put on some sort of medication that would help, because I was taking Tylenol like every 6 hours on the dot, and it doesn't touch my pain. I can't feel it at all. It's a very common thing with people with Ehlers-Danlos Syndrome. We metabolize local anesthetics like the shots you get at the dentist, and also pain medications, differently. We tend to burn them off a lot faster, so they don't really take care of the pain. When I go to the dentist and have procedures done, I have to ask for extra shots, which is just so fun. I have this fear that when I go to the doctor, they're just going to see me as drug seeking. And at this point, I am. For legal reasons, this is a joke. Like, please, give me pills. I hurt so bad. Ugh. I basically roll out of bed, feed my animals, and then sit on the couch propped up with pillows for the rest of the day, because I don't have the energy in my body to unload the dishwasher or do laundry or go to the grocery store. At this point with the pandemic, the less I have to leave the house, the better. Grocery delivery is extremely helpful, but clothes and dishes just piling up constantly, and I feel disgusting. This video has gotten quite away from me. It was supposed to be very happy and a celebration of disabled bodies and community, and the reality is I'm struggling. I'm struggling right now. I am very happy, very proud to be a zebra, but I almost didn't make this video today because getting out of bed and putting on these leggings, between that and taking a shower yesterday, all my spoons are spent. I'm gonna go snuggle my dog on the couch and order some food to keep my body fueled. Try to give myself a break today, because if there's any day that my body deserves to be listened to and given a rest, it's International Day of Disability. Hope you enjoyed getting to know me a little bit better and my struggle, my journey. I'm gonna have to edit this down so much. Bye.